Evoke 2 study. So Evoke 2 is Sacituzumab Govitecan in non-small cell lung cancer. What is Sacituzumab Govitecan? Sacituzumab and Govitecan. Sacituzumab is a monoclonal antibody against Trop2. What is Trop2? It's a calcium signal transducer. It is there both on the cell membrane and also in the cytoplasm of cancer cells. It was initially detected in trophoblast, therefore it is Trop2. It is also present in lung, breast, and also in urinary bladder. Therefore, you would see sacituzumab being used in multiple cancer types. Then comes Govitecan. Govitecan looks similar like irinotecan, right? So the active component of irinotecan, SN38, is what is Govitecan, and it is a topoisomerase inhibitor. To put it in simple terms, it is a Trop2 antibody with an irinotecan tag, that is Sacituzumab Govitecan. Dapototumab deruxtecan, Dato-DXT, also has action on Trop2, right? Now coming on to Sacituzumab, where and all it is approved. It has got clinical trials in triple negative breast cancer, third line and beyond setting. The name of the trial is the ASCENT trial. It improved overall survival, which was statistically significant, 12 versus 6 months. Similarly, in hormone receptor positive metastatic breast cancer, the name of the trial is TROPICS-02 study. Again, third line beyond setting, improvement in overall survival significant, 14 versus 11 months. Based on this, sacituzumab is approved in these two settings. Whereas in metastatic urothelial carcinoma, the TROPICS-04 did not show overall survival benefit. Therefore, the approval is withdrawn in metastatic urothelial carcinoma. So in the present day, TNBC and HR positive, hormone receptor positive breast cancer, third line and beyond setting is where the approval is. Let us see what is the data of Sacituzumab Govitecan in the non-small cell lung cancer space. Right. So you have Evoke 1, 2, and 3. Evoke 1 is a phase 3 randomized trial of second-line treatment of non-small cell lung cancer, docetaxel versus Sacituzumab Govitecan. The overall survival was similar, and it was not significant. Therefore, it is a negative trial. However, in the PD-L1 negative subgroup, this did later, Sacituzumab Govitecan did little better, right? Then coming on to the Evoke 2 study, which I'm going to discuss. It's a phase 2 multi-center study. First line, pembrolizumab plus Sacituzumab Govitecan plus carboplatin, which is a phase 2 study. Evoke 3 is a phase 3 study of PD-L1 TPS more than 50%, pembrolizumab plus Sacituzumab Govitecan versus pembrolizumab. We have to wait for the results. Right. So Evoke 2 is simply a multicentric phase 2 non-small cell lung cancer. First line, of course, no driver mutations. Pembro plus carbo plus Sacituzumab Govitecan. Cohort C was non-squamous and cohort D was squamous. This is how the trial design looks like. Just remember cohort C, cohort 2, cohort D. Dose of sacituzumab. If you are giving sacituzumab Govitecan as monotherapy, it is 10 milligrams per kg. Whereas, if you have to combine with chemotherapy, just note the dose day 1, day 8, every 21 days. Whereas if you have to combine with chemotherapy, it is 7.5 milligrams per kg because of the dose limiting toxicity with 10 milligram per kg. Right. If you come to the demographics, only thing that you have to notice, the PDL1 expression of less than 50% is seen in 85% patients and 90% patients. The reason is those who are more than 50 went on to evoke 3. That's the probable reason which I can think of. Now, the response rate is around 40% and the PFS is around 8 months. This is how the responses look like in both non-squamous and squamous. And then coming on to, if I am using Keynote 189 as the comparator and Evoke 2 in the other hand, which is the winner, overall response looks similar. Median PFS numerically, the Keynote 189 arm looks better. However, it would be interesting to see the subset PDL1 less than 1%. So the side effects of Sacituzumab Govitecan are neutropenia, stomatitis with dato-DXd, ocular toxicity has to be remembered. What are the conclusions of this presentation? Sacituzumab Govitecan is an anti-Trop 2 antibody plus SN38. This combination. 2 approved indications in the present day, triple negative breast cancer and HR positive metastatic breast cancer. This is the space. Third line and beyond setting. For metastatic urothelial carcinoma, it is withdrawn. Evoke 1 was second line. Sacituzumab Govitecan versus docetaxel, no OS benefit. Therefore, it is a negative trial. And in PDL1 negative subset, Sacituzumab did better. Coming on to Evoke 2 study, the present study which I discussed, it is the response rates and PFS are fine, but they are not that great when compared to the Keynote 189. However, you have to look into the subset of PDL1 less than 1%. Neutropenia and stomatitis are the toxicities of Sacituzumab Govitecan, and remember the dose when I use Sacituzumab in combination with chemo. It is 7.5 milligram per kg and not 10 milligram per kg. It is day 1, day 8, every 21 days. Well, before I take this into practice, I would need further studies, especially addressing the PDL1 negative subset. And we also have to wait for the results of Evoke 3. Thank you.